Welcome to 41 Today Lifestyle, everyone. I'm Troy Thompson. Joining me in the studio today is Dr. Malhotra, and of course, she's from Georgia Cancer Specialist. And the reason why we brought her in today is because we want everyone to remember that January is the month of cervical cancer awareness. How are you, my friend?
Good, thank you.
Welcome to the show. Thank you for coming in what is a very important conversation to have for all the women out there, and also I think it's a great conversation for mothers to have with their daughters, right?
Sure.
How do we open that conversation to begin with, from mother to daughter? And at what age should we be having that conversation?
So it starts very early in the sense that when they are young teenagers, it starts in the sense because of the HPV vaccine now we have.
Right.
And then because once the HPV vaccine is given, it does protect against cervical cancer.
Okay.
So once they become sexually active, that's the time to get started.
And we should be having that open conversation.
Right.
Okay. Now, what's the incidence of cervical cancer in the state of America?
So the incidence of cervical cancer is, we get diagnosed approximately 14,000 new cases every year.
Really?
And out of those 14,000, 3,200 die of cervical cancer.
That's quite high.
Yes.
Where do we stand in America? Is it number 3, number 4, number 5?
It's number 3 out of gynecological malignancies, in which endometrial and ovarian are 1 and 2.
Really?
Right.
Okay. What are the treatments? Well, before I get to the treatments, if our female viewers sitting at home are thinking to themselves, I haven't gone in for a screening, what's involved with this screening to begin with? And is there any signs or symptoms that they may have that could give them a clue that you haven't been in for a screening and you have cervical cancer?
So the screening is very easy for cervical cancer. So females who are sexually active should start their screening at age 21.
Oh, wow.
From 21 to 30, the screening is by pap smear, which is, if you have 3 pap smears which are negative, it's every 3 years.
Okay.
You don't have to worry about. After 30 years of age, the screening is done double, in which they get tested by pap smear and HPV DNA testing.
Oh.
And if that is negative, you don't have to get tested for 5 years.
Okay.
And the screening stops at age 65.
Okay. What are some signs that we may have cervical cancer?
So main signs are vaginal bleeding.
Yes.
And then most likely the other main important thing to know is, like, if you are having a postmenopausal bleeding, that's for the older women. Younger women, if they are having postcoital bleeding, like bleeding after having sex.
Okay. What are some of the risk factors of cervical cancer?
So the risk factors are mainly multiple sexual partners.
Yes.
And then if you have smoking history, then you are at more risk of developing cervical cancer. Last but not least is immunocompromised state, like HIV patients have more. Patients who are on immunosuppressive therapy have more chances of having cervical cancer.
Really?
Yes.
Okay. Well, explain to everyone at home, if you do get that diagnosis, what are some of the treatments?
So the treatment depends upon the stage. If the cervical cancer is diagnosed early, in early stage, the treatment is surgery.
Really?
Yes.
What type of surgery?
Surgery is mainly hysterectomy with removing of the tubes and ovaries, depending upon how far.
It's quite a severe operation.
Right. But it's very well tolerated in the sense that it does come with some side effects, but then if you have early stage disease, it's very curable disease. So why not to go through that?
Yeah.
And then if it is locally advanced disease, the treatment of choice is to do chemo and radiation together.
That's the treatment plan,
Right.
and that's the course. Thank you so much for coming in. We really appreciate it.
Thank you.
Thank you, Doctor.
Thank
if you
you
want
for
to find
having
out more about Georgia Cancer Specialist, there it all is up on the screen. They'll take care of you. And if you haven't had a screening, go in and make sure you do. Back after this short break.